you help us understand some of the common issues that myeloma patients experience and how they might be managed?
Sure. So fatigue is an absolutely huge one. And fatigue can come from a lot of different things. One, fatigue can come from other medicines. A lot of patients have cardiac issues and may be on other medicines causing fatigue. So optimizing your other clinical status is important. Anemia can lead to fatigue. So we monitor your blood counts very closely. And if they drop, can we provide medicines to boost them up? Drugs, some of the therapies we have can cause fatigue. And one of the biggest ones is Revlimid. And I tell people what actually tends to help is you take the Revlimid at night instead of in the morning, because if you take it at night, it tends to maximize the fatigue while you're already sleeping. If you take it in the morning, it tends to maximize at that horrible caffeine eating hour of 3 to 4, 4 to 5, where you're like, oh, I got to lie down. So fatigue is a really big one. Neuropathy. Neuropathy is really getting less and less in our newer patients because more of our modern drugs don't cause it. But unfortunately, some patients still have neuropathy, and they may be using drugs like gabapentin or Lyrica. There's some other really old drugs and new drugs that can help. Drugs like Pamelor, which is nortriptyline, or Cymbalta may help quite a bit, or another drug called Effexor. And many of these drugs may be used for anxiety and depression, but also work for neuropathy. And then even going to things like the cannabinoids, things like marijuana derivatives may actually be able to help, both in salves or even edibles may actually help some of the neuropathy issues. And then we can get into some kind of out there stuff like compounding ketamine to help with some of these salves or oral combinations. So again, a little bit of neuropathy, let us know because there may be some ways to help.